How do genes cause UTIs in children? Imagine your body as a complex city with many different parts working together to keep everything running smoothly. Sometimes, though, certain parts might have tiny issues that make it easier for problems like urinary tract infections to happen. Genes, which are like the instruction manuals inside our cells, can influence how our bodies develop and fight infections. In children, genes can play a role in making some kids more prone to urinary tract infections, or UTIs, by affecting the shape of their urinary system or how well their immune system fights bacteria. One way genes can cause UTIs is by influencing the structure of the urinary tract. Some children inherit conditions like vesicoureteral reflux, which is when urine flows backward from the bladder toward the kidneys. This abnormal flow can carry bacteria up into the kidneys and cause infections. Vesicoureteral reflux tends to run in families, so if a child's parents or siblings had it, the child might be more likely to have it too. The genes involved in normal urinary tract development can sometimes have variations or mutations that disrupt this process, leading to structural issues that make infections more likely. Besides structural factors, genetic differences also affect how well a child's immune system can fight off bacteria. Our immune system has special proteins that help kill bacteria, like RNase 7. Some children inherit versions of the gene for RNase 7 that produce less effective forms of this protein. When these proteins don't work as well, bacteria can survive longer in the urinary tract, increasing the chance of infection. Other immune-related genes can also have variations that make the immune response weaker, which means bacteria are less likely to be cleared out quickly. Family history is another clue that genetics are involved. If a child has relatives who had UTIs or urinary tract abnormalities, they are more likely to develop UTIs themselves. Different types of UTIs, like infections of the bladder or the kidneys, may even be influenced by different genes, which shows how complex this genetic link really is. It's important to remember that genes are just one part of the story. Environmental factors like good hygiene, staying well hydrated, and healthy bladder habits also play a big role. Sometimes, structural issues caused by genetics can be made worse by these behaviors, increasing the risk of infection. In summary, genes can cause UTIs in children mainly by affecting the shape and function of the urinary tract and by influencing how effectively the immune system fights bacteria. This genetic predisposition, combined with environmental factors, helps explain why some children are more prone to these infections. Understanding these genetic factors can help doctors identify children at higher risk and develop better prevention and treatment plans. If your child has recurrent UTIs, it's always best to consult a healthcare professional who can evaluate their specific situation and guide appropriate care.